Council come to the table, please. And Senator Madigan, you have the call once we've got some people to ask questions of. Senator Madigan.
Thank you, Chair. My questions are in regards to the NHMRC draft information paper, evidence on wind farms and human health. My office has received information the NHMRC was cautioned about the involvement in this project of an acoustician working for Sinclair Knights Merst, Dr Norm Broner. As you're probably aware, SKM is a major consultant utilised extensively by the wind industry. And secondly, I understand the NHMRC was cautioned against the involvement in this draft paper of Dr Liz Hanna, President of the Climate and Health Alliance. The Climate and Health Alliance has also been an aggressive pro-wind campaigner, including publicly supporting a pro-wind digital media campaign by Danish wind conglomerate Vestas. First question, how have conflicts of interest been identified and managed by the NHMRC?
John McCallum, Head of Research Translation, NHMRC. We have a defined process and policy for identification of conflicts, and then the discussion of those between the office of NHMRC, in this case my office, and the chair of that group. Any conflicts deemed to be major are excluded. So we generally have people, you have to balance, of course, the need for expertise in a group where there's very few experts with the fact that there will be interests that people declare. Those conflicts are then managed according to that protocol. People may stand out from meetings on issues in which they have a conflict.
Why are these conflicts even there when the NHMRC is supposed to be independent?
I'm sorry, Warwick Anderson, CEO of the National Health and Medical Research Centre. I'm sorry, Senator, I didn't quite catch your question.
Why are these conflicts even there when the NHMRC is supposed to be independent?
Well, Senator, I'm sure you'll understand in the wide range of activities we do, there are, when we engage experts across everything we do, and mostly, of course, around peer review, there's always a call between people who've got expertise in the area that we need their brains at the table, if I could put it that way, versus people who then have a vested interest, a conflict of interest which moves beyond. So as John said, this is for all our committees, this is really a moment-by-moment process we undertake so that chairs are briefed, and at the moment that the conflict of interest arise, our policy is those people are outside the room. The other way we deal with it, of course, is put all these conflicts in the public domain. All their declarations are conflicts in the public domain, and so that does allow people to challenge this where required, and that was true of the wind farm expert group. They were all in the public domain.
Why is the only acoustician on that panel someone who has officially undisclosed strong financial ties with the wind industry and possibly a vested commercial interest in denying the adverse health effects?
That allegation has not been brought to our attention before, as far as I'm aware.
John McCallum again. Senator, the conflicts of the acousticians who you've mentioned were declared. We have a very, very experienced chair of that committee, and he and I determined that the balance of that expertise against the interests that person had were ones that could be managed within the context of that committee.
Given that the NHMRC has recommended further research into this area, how is it the NHMRC is going to make sure that there are no wind industry advocates in the ranks of the researchers and that properly conducted and truly independent research will take place?
Well, Senator, perhaps just to clarify the further research will be conducted by researchers out there in universities, medical research institutes and hospitals. So provided that we decide to do this, which we probably will, after we've had the feedback from the community, we will identify the areas of research that are needed. They're quite well identified already in the information paper. And then we will advertise those for people to apply for funding to conduct the research. And we will do our usual high-quality peer review process. By we, I mean we will set up peer review panels to do the analysis of which research should be funded. So that research will not be done by officers of the NHMRC, it'll be done in the university sector.
Mary Morris was the author of the only Australian research which met the criteria for the NHMRC Wind Farms and Human Health Review, yet in direct contradiction to that research findings, you told the PM program on ABC radio the effects of noise on people from wind farms would be limited to less than half a kilometre. Mary Morris's report makes it clear there have been reported impacts out to 10 kilometres. Did you read her report?
And, Senator, I relied on the literature review that was done and the information paper. And in the information paper, there are many reports of noise and wind farms. But what the report makes, that I'm sure you're aware, having read it, that there's strong criticism of nearly all the research that's been done, particularly around so-called selection bias, and that is people not deliberately but inadvertently getting feedback from people who already knew what the research was about. This is really, like most epidemiology, this is really quite a complex issue, and the report, I think, sets out very clearly and in some detail why all the research is, you know, of either poor quality or not so poor quality. I'm aware of Dr. Morris's comments. She has contacted me, and I've referred those on to the expert committee to take into account as we update this draft. But it's not the only report of noise around wind farms, and I think as the summary says, and I think that's very accurate, it says there is consistent but poor quality evidence that proximity to wind farms is associated with annoyance and less consistently with sleep disturbance and poorer quality of life, and that's under the noise heading. So fully respect Dr. Morris's research, but there is quite a lot of other research. But in the eyes of our experts, this research is of relatively poor quality for technical, scientific reasons.
So, could you make the next question your last, please, Senator Madigan? Thank you.
Would the NHMRC consider in its further deliberations possibly, and you've made it clear that you actually haven't decided to do any more, that's what you said. Now, would it be fair, could the NHMR, if you're going to have acousticians that obviously have a perceived conflict of interest with some people in the community, that you balance that with some other acousticians, because I can assure you there are other acousticians out there in the community who are amply qualified, far as adequately qualified as Dr. Norm Broner, so that at least you have a balance on that committee?
Senator, one of the recommendations of the review that further research be done in the noise and acoustics area. Now, that's not medical research, so we would work with other departments to do that. But if research needs to be done,
Well, we're talking about the peer review, you know, that you're talking about a review of information. I'm suggesting to you it'd be a good thing to have a balance on that committee, both between an opposing professional and a pro-industry professional.
Well, I'm not accepting your, because I don't know whether this person is pro-industry, but he was identified as somebody of particular expertise. But look, I take your comment. We are always very keen to make sure we have expertise and conflicts of interest out in public, and if there are matters we need to take into account and you've brought them to my attention, I will take them into account.
Thank you. Thank you, Chair. Senator
Di Natale, you had questions in this area?
I did. So can I conclude from the NHMRC study into wind turbines that there is no evidence that a discrete condition known as wind turbine syndrome exists?
I don't think our report
I'm asking you,
no,
would that be a fair statement?
No, Senator, I think you're putting words in my mouth.
Yes.
I think the report says what it says, and that at this stage there's no reliable or consistent evidence that wind farms directly cause adverse health effects in humans. That's no reliable, consistent at this time. So I don't think you should push me to conclude beyond what my expert committee has concluded.
There's no evidence that if I lived next door to a, let's just say I lived next door to a telegraph pole, that's not making me sick, because I'm asking you to prove a negative. So I just want to be clear here. You didn't find any evidence for a condition known as wind turbine syndrome as part of your study. Is that a correct statement?
No, it wasn't in the terms of reference for the expert group to do that. But I just want to make sure we are on the same page here.
Yes.
So this is an information paper, and draft for that matter. It's not the NHMRC's position paper. So our position paper, put out in 2010, we will update our position paper after we've completed the feedback from the community on the information paper, looked at the evidence that's occurred since then, as we've said on our website, and then finalise the information paper. Then we will consider what extra research needs to be done, and since the research so far is poor quality, that's almost certain there is research that needs to be done. And then the second thing is we'll update our position paper, and I think that position paper is more relevant to your point.
What I'm trying to understand is, why are you commissioning more research into this field, given that nothing that you found indicates that this is a cause for concern?
Well, I don't think, again, with respect, you've quite summarised our position. We've said...
let me ask you the question, have you found anything that gives you cause for concern here?
Yeah, the poor quality of the research so far.
But there's no research into whether aliens were going...
Senator Di Natale, can you ask questions?
Yes, but I mean... This goes to the heart of the question. I mean, the fact that there's no research to arrive at a particular position isn't in and of itself a reason to conduct research into a particular area that most people in the scientific community would regard as being unlikely, or most people, I suggest, would say almost certainly not an area for concern. So what I'm asking is, given that you haven't found any positive evidence to suggest that there is an area of concern, and your only rationale for wanting to conduct more research into this is that there's very little good quality evidence, why are you suggesting that we go down that path?
But the conclusion of the report is there is consistent, though poor quality evidence, that proximity to wind farms is associated with annoyance and less consistent with sleep disturbance, poorer quality of life. And I'm sure you would understand, Senator, given your training, that annoyance for long term, as the report says, can turn into poor and physical health through stress. So I don't think, we may have to disagree on this, because I don't think that you can dismiss easily community concern about this matter. How well placed, how scientifically based, it is clearly some community concern. There was, after all, a Senate committee on wind farms. It did find, the Senate committee found, that more research was needed, and we responded through the department that we agreed with that. So I think I understand that you're saying that even though the research is not very strong, no more research is needed. I think what the expert group has said is that in this area, not the direct effects now, but in the indirect effects, where cause and effect is not known, the research was all cross-sectional, the effects are all self-reported and so on, that there are questions. And, you know, our Act says we're here to improve community and individual health. This is an issue that was brought to us by the state health departments, so I do think it's important we don't dismiss those concerns. We look at what the evidence has been brought to us by the expert committee and by the feedback, and then make a decision.
Senator Di Natale, last question, please.
I've only asked one question. I thought Senator Madigan had an opportunity to ask a few questions. I'd like to be afforded the same opportunity.
I'm sorry, if you want to debate the issue, that's different. But you've had more than 6 minutes on this topic already, which is exactly what Senator Madigan had.
Are you concerned that that by concluding that more research is required, that you may contribute to the fear and anxiety that exists around this issue? Because you are giving some succour to those people in the community who do hold those fears? And secondly, do you also hold concerns that every dollar spent in this area by the NHMRC is $1 that would be one less dollar that can be spent on cancer research, that can be spent on research into chronic disease, that can be spent into areas like infant mortality across a range of conditions? Is that of any concern to you, Mr. Anderson or Professor Anderson?
So certainly making our funding go as far as possible on important issues, Senator. The fact we call for research doesn't mean we'll spend it, because we'll need high quality research. I remind you that there were similar concerns in this area around mobile phones earlier, and it was only when very high quality long-term epidemiology research was done that we were able to dismiss those concerns.
Some people continue to have those concerns.
Thank you, Senator Di Natale. Senator Carr.
Professor Anderson, can I